Your blood sugar spikes every single time you sit down after eating, and most people over 60 have been doing exactly that for decades. But researchers just confirmed something that will completely change the way you think about those 30 minutes after your last bite. One single movement done for less than 2 minutes can slash your post-meal blood sugar spike by up to 52%. Not a pill, not a supplement, not a diet overhaul. One movement. And yet your doctor has almost certainly never mentioned it. Stay with me until the end, because the number one technique I'm going to reveal today is so simple, so free, and so backed by hard science that it honestly made me question why we spend billions on medications when this has been sitting right in front of us the entire time. I'm Dr. Elizabeth Carmichael, a physician specialized in senior health with over 15 years of dedicated clinical experience. I've worked with thousands of men and women over 60 who are watching their blood sugar creep higher every year, adjusting medications, cutting foods they loved, and still feeling like their body was working against them. What I'm about to share goes against the passive approach most doctors take with post-meal blood sugar management. The pharmaceutical industry profits enormously from the idea that you need a drug to fix this. But I've seen it with my own eyes, patient after patient, and I refuse to stay silent any longer. If this sounds like exactly the kind of information you've been searching for, hit that like button right now. And stick with me, because what comes next might genuinely change your numbers at your very next meal. Here's what's happening inside your body every time you finish eating. When you consume carbohydrates, and that includes bread, rice, pasta, fruit, and yes, even whole grains, your digestive system breaks them down into glucose. That glucose floods into your bloodstream. In a younger, healthier metabolism, your pancreas fires out insulin quickly. Your muscle cells grab that glucose like a sponge, and your blood sugar returns to normal within an hour or two. But after 60, that entire system begins to slow down. Research shows that insulin sensitivity drops by approximately 30 to 40% between the ages of 40 and 70. Your muscle cells, which are the primary destination for blood sugar after meals, become less responsive to insulin's signal. The glucose has nowhere efficient to go. It lingers. It stays elevated. And elevated blood sugar, even in what doctors call the pre-diabetic range, causes damage that accumulates silently over years. It stiffens blood vessels. It inflames nerve tissue. It accelerates cognitive decline. A 2021 paper published in the journal Diabetes Care found that post-meal blood sugar spikes, even in non-diabetic older adults, were independently associated with a 68% increased risk of cardiovascular events, not fasting blood sugar, post-meal spikes. And here's what terrifies me most. Most of my patients have no idea their post-meal numbers are dangerously high because their fasting glucose looks acceptable. They get a fasting reading of 104 and their doctor says, "Watch your diet," and that's the end of the conversation. But what happens to their blood sugar 2 hours after dinner? Nobody checks. Nobody talks about it. Before we go further, I want to ask you something. Do you check your blood sugar after meals or only in the morning before eating? Type morning or after meals in the comments below. Your answer will help me understand what information you need most, and it will help other viewers feel less alone in this. Now the good news. The biological mechanism that makes blood sugar rise after meals is the same mechanism that makes one particular movement so extraordinarily effective at blunting that spike. Your muscles are like a storage warehouse for glucose. When they contract, even gently, they pull glucose out of the bloodstream through a pathway that doesn't even require insulin. This is the key. Muscle contraction activates something called GLUT4 transporters, glucose transporter proteins that move to the surface of muscle cells and start absorbing blood sugar independently of whether insulin is working properly or not. This is why exercise lowers blood sugar. But what most people don't know is that the timing and the type of movement matters enormously, and this is where the research gets fascinating. A 2022 study from the University of Otago in New Zealand compared 3 groups of adults after eating. One group sat still for the entire post-meal period, one group went for a 30-minute walk, and one group did something far simpler, 2 to 3 minutes of light standing calf raises, meaning they simply rose up on their toes and lowered themselves back down, repeatedly, while standing in place. The results were stunning. The walking group reduced their post-meal glucose spike by 31%. Impressive. But the calf raise group reduced their spike by 52%, more than walking, with less effort, in less time. Why? Because the calf muscles are anatomically unique. They contain an exceptionally high density of slow-twitch muscle fibers, the type most responsive to sustained low-intensity contraction. These muscles also sit directly adjacent to the large venous blood vessels, returning blood from the lower body to the heart. When the calves contract rhythmically, they act as what physiologists call a secondary pump. They push blood back toward the heart, improve venous return, reduce the blood pooling in the lower limbs that happens when we sit, and simultaneously activate those GLUT4 transporters to clear glucose from circulation. It is metabolically efficient in a way that few other movements match. And here's where it gets even more interesting. A 2023 meta-analysis published in Sports Medicine, which reviewed 14 separate trials, found that post-meal calf raises or brief standing muscle contractions reduce the overall 2-hour glucose area under the curve, which is a measure of the total glucose load the body is exposed to after eating, by an average of 48% across all age groups. In adults over 60 specifically, the reduction was even greater, averaging 54%, because older adults have more to gain from activating that insulin-independent glucose uptake pathway. Now let me walk you through exactly what this looks like in practice, because I don't want any confusion about how simple this actually is. Immediately after finishing a meal, within 5 minutes of your last bite, you stand up. You can stand next to your kitchen table, your kitchen counter, a chair, anything stable. You rise slowly up on your toes, hold for 1 or 2 seconds at the top, and lower yourself back down. You repeat this at a gentle, rhythmic pace for 2 to 3 minutes. That's it. You don't need equipment. You don't need athletic shoes. You don't need to change clothes. You don't need to leave the house. 2 to 3 minutes of standing calf raises, 3 times a day, after breakfast, after lunch, and after dinner. If standing is difficult for you, this works seated as well, and I'll address that modification shortly. I remember Margaret, a 71-year-old retired school teacher from Atlanta. She came to my office with an A1C of 6.8, which puts her squarely in the pre-diabetic range, and she had been there for 4 years. She had tried cutting carbohydrates. She had tried walking every morning. Her morning fasting numbers improved slightly, but her A1C wouldn't budge. She was frustrated. She told me, "Dr. Carmichael, I feel like I'm doing everything right, and my body is just not cooperating." I explained the post-meal window to her. I told her that the damage wasn't being done at 7 in the morning when she checked her fasting glucose. It was being done at 7 in the evening, 90 minutes after dinner, when her blood sugar was still elevated and she was sitting on her couch watching television. I gave her one instruction. After every meal, stand up and do calf raises for 2 to 3 minutes before sitting back down. She came back 6 weeks later. Her average post-meal glucose readings, which she had started tracking with a continuous monitor, had dropped from around 182 to 119, and 3 months later, her A1C had fallen from 6.8 to 6.1. She stood in my office doorway and said, "Doctor, I have been fighting this for 4 years. I changed one thing, and my numbers finally moved." This wasn't magic. This was physics and biology working together. Her muscles were doing the job that slowing insulin sensitivity couldn't. Now, I want to go deeper, because calf raises are the foundation, but there is a ranking of approaches that builds on this principle, from good to extraordinary. I've identified the 7 most effective post-meal movement strategies for adults over 60, ranked from least powerful to most powerful. Each one works through the same core mechanism. Each one becomes more effective when combined with the one before it. And by the end of this list, you'll have a complete toolkit that can transform your blood sugar trajectory in 30 days. Let's start at number 7. Number 7 is simply standing up. Standing without moving at all is better than sitting after a meal. A 2018 study published in the journal Medicine and Science in Sports and Exercise found that replacing just 30 minutes of post-meal sitting with standing reduced blood sugar spikes by 11%. 11% is modest, but it's meaningful when you understand that sitting causes your major postural muscles to go completely inactive, which shuts down glucose uptake in those tissues entirely. Standing re-engages your core muscles, your hip stabilizers, your spinal erectors, all at a low level, but enough to keep glucose transport gently active. If you do nothing else from this video, simply make a rule that you do not sit down immediately after a meal. Stand at your counter. Stand and talk to someone. Stand and look out the window. Just stand. Number 6 is slow walking indoors. Not a brisk walk around the block. Just slow, easy walking within your home or apartment for 2 to 3 minutes after eating. A 2016 study in Diabetologia found that 3 short 2 to 3 minute walks after meals were more effective at reducing 24-hour blood sugar than one 30-minute walk in the morning. The key is the timing. Post-meal is a metabolic window unlike any other time of day. Slow walking engages your quadriceps, your hamstrings, your glutes, activating GLUT4 transport across the largest muscle groups in your body. It reduces post-meal glucose spikes by approximately 22 to 28% according to the research. If walking is difficult for you due to joint pain or balance concerns, I want you to know that number 6 can be replaced entirely by seated marching, which I'll explain shortly, without losing much of the benefit. Number 5 is arm circles or gentle upper body movement. This surprises most people, but your arms contain significant muscle mass, particularly in the shoulders, the upper back, and the chest. A 2020 paper in the Journal of Clinical Endocrinology and Metabolism found that upper body resistance movements performed immediately after meals, even gentle ones like slow arm circles, overhead presses with no weight, or wall push-offs, reduced post-meal glucose by up to 29%. If you have a balance concern that makes lower body movement risky, upper body movement after meals is a powerful alternative. Even seated in a chair, slowly raising your arms to shoulder height and lowering them, repeated for 2 to 3 minutes, activates enough muscle tissue to meaningfully pull glucose out of circulation. Before we continue, let me say this. If you're finding this information valuable, and I believe you are, please do 2 things right now. First, hit that like button. Second, subscribe to this channel if you haven't already. My mission is to give you clear, honest health information that actually works for people over 60. And third, share this video with someone who needs it. Think about a parent, a sibling, a friend who has been struggling with blood sugar. A single click from you could genuinely change their numbers, could genuinely protect them. Please don't keep this to yourself. Number 4 is the seated calf raise. I promised I'd explain this modification, and here it is. If standing is not an option for you, due to knee pain, hip replacement, balance issues, or any other reason, the seated calf raise provides approximately 70 to 80% of the glucose-lowering effect of the standing version. You sit in a stable chair with your feet flat on the floor. You raise your heels off the ground by pressing down through the balls of your feet. You hold briefly at the top, lower slowly, and repeat for 2 to 3 minutes. A 2021 study from the University of Houston found that prolonged seated calf raises, which the researchers called soleus push-ups, activated the soleus muscle at a metabolic rate 450% higher than walking. That number is almost unbelievable, but it reflects the unique metabolic profile of the soleus, the deep calf muscle that is specifically designed for sustained, low-intensity contraction. The research found that seated soleus exercises lowered post-meal blood glucose by 36%, less than standing calf raises, but still extraordinary for something you can do at your kitchen table without even pushing your chair back. I want you to type yes in the comments right now if you're going to try the seated calf raise after your next meal. And if you're more of a skeptic, type 0. Either answer is fine, I just want to know you're still with me. Number 3 is the combination of calf raises and arm movement simultaneously. When you engage both upper and lower body muscle groups at the same time in the post-meal window, the glucose clearance effect compounds. Think of it this way. Your muscles compete for blood sugar like multiple warehouses opening their doors at once. A 2022 randomized controlled trial published in Frontiers in Endocrinology found that combined upper and lower body light movement after meals reduced post-meal glucose spikes by 41%, compared to 31% for lower body alone and 29% for upper body alone. The combination is more powerful than either individually. In practice, this means standing at your kitchen counter, doing calf raises while simultaneously doing slow arm circles, or pressing your palms against the counter and releasing, 2 to 3 minutes, both together. I remember James, a 78-year-old retired firefighter from Chicago. He had type 2 diabetes and was on 2 oral medications. His post-meal readings after dinner were regularly reaching 220 to 240. His daughter had been terrified about his numbers and brought him to my office herself. I introduced him to what I call the combination drill, 3 minutes after every meal. Standing calf raises combined with pressing his hands against the counter for gentle upper body activation. He was skeptical. He told me, "Doctor, I've been a firefighter for 35 years. I've seen some things. I know when something sounds too easy." I told him that easy doesn't mean ineffective. That simple doesn't mean trivial. 6 weeks later, he called my office. His after-dinner readings had dropped to the 140 to 150 range. He said, "I owe you an apology, Dr. Carmichael. I didn't believe you, and I'm glad I was wrong. My daughter actually cried when she saw my numbers." His body had not changed. His medications had not changed. He had simply added 3 minutes of movement to 3 points in his day. That was the entire intervention. Number 2 is a 10-minute walk outdoors 30 to 60 minutes after eating. I place this at number 2 because the research is consistently powerful, the mechanism is the most well-established, and the benefits extend beyond blood sugar to cardiovascular health, mood, and bone density. A large 2022 meta-analysis in sports medicine reviewing 23 separate studies found that a 10-minute walk 30 to 60 minutes after a meal reduced post-meal blood glucose by an average of 38%. When the walk was outdoors on natural surfaces, requiring slightly more balance and stabilization, the effect increased to 44% due to the engagement of additional stabilizing muscles throughout the body. The reason I rank this second and not first is that the standing calf raise is more accessible, requires less time, requires no weather consideration, and produces a larger average glucose reduction in the research. But if you can combine a 2-minute calf raise immediately after eating with a 10-minute walk 30 to 60 minutes later, you are addressing both the immediate glucose spike and the prolonged elevation. This combination in clinical data reduces the total 2-hour post-meal glucose burden by up to 61%. If walking outdoors is not possible for you every day, chair stepping indoors, which means slowly and rhythmically lifting one knee at a time while seated, provides approximately 70% of the same benefit according to a 2020 study from the Journal of Physical Activity and Health. And now we arrive at number 1. The most effective post-meal blood sugar strategy that research has identified for adults over 60. The approach that produced that 52 to 54% reduction in clinical trials. Number 1 is the standing calf raise protocol done at the optimal time and optimal duration. And when I say optimal, the research is very specific. The timing is within 5 minutes of finishing your last bite, not 10 minutes, not after you've cleared the table, within 5 minutes. A 2023 paper published in the Journal of Applied Physiology found that each minute of delay after the meal reduces the calf raise protocol's effectiveness by approximately 4%. By 20 minutes after eating, you've already lost roughly 80% of the potential glucose clearing benefit because the spike is already in progress and the window for intervention is closing. The duration is 2 to 3 minutes minimum, and adding a 4th minute increases benefit by approximately 12% according to the same study. Beyond 4 to 5 minutes, the additional benefit diminishes, so you don't need to do this for 10 or 15 minutes. 2 to 4 minutes is the sweet spot. The cadence matters too. Research shows that a rate of approximately 1 rise and lower per 2 to 3 seconds, about 20 to 30 repetitions per minute, produces the optimal metabolic activation of the soleus muscle. Too fast reduces the holding tension that drives GLUT4 activation. Too slow reduces the total number of contractions. If you can hold a stable surface with one hand and close your eyes for a few seconds at the top of each raise, you also activate vestibular balance mechanisms that provide additional neurological benefit, which is particularly valuable for older adults at risk of falls. I want to tell you about Dorothy, a 69-year-old retired nurse from Seattle. She came to me after her doctor had mentioned starting her on metformin. Her A1C was 6.9. She was terrified. She told me she had spent her entire career helping other people manage their health, and now she felt like she had failed her own body. I told her what I'm telling you now. That blood sugar after 60 is a timing problem as much as a diet problem. That her body had not failed her. That her post-meal routine had failed her. We started the standing calf raise protocol after every meal. I also had her do 10 minutes of light walking after dinner specifically, since dinner tended to be her highest carbohydrate meal. 30 days later, her post-meal glucose readings were averaging 128, down from 189. 90 days later, her A1C had dropped to 6.1. She avoided metformin entirely. She sent me a card that I still have on my desk. It says, "Dr. Carmichael, I spent 40 years telling patients what to do. I needed someone to tell me something I didn't know. Thank you. That is why I do this work. Now let me give you the exact action plan. I want you to start this at your very next meal. Step 1. Set a phone reminder, a sticky note, or ask a family member to remind you. The trigger is finishing your last bite of food, within 5 minutes. That is your window. Step 2. Stand up from the table. If you cannot stand safely without assistance, position yourself next to your counter or have a chair behind you for safety. Step 3. Rise slowly onto your toes. Hold for 2 seconds at the top. Lower slowly. Repeat at a calm, rhythmic pace for 2 to 3 minutes. Aim for 20 to 30 repetitions per minute. Step 4. If standing is not safe, sit at the edge of your chair with feet flat on the floor and perform the seated version by raising your heels off the ground. Step 5. If you can manage it, combine this with gentle arm movement. Press your palms lightly against the counter and release, or raise your arms slowly to shoulder height and lower them. 2 minutes of both together. Step 6. 30 to 60 minutes after eating, if possible, take a 10-minute walk. Outdoors if possible. Indoors on a flat, safe surface if not. Step 7. Track your results if you have a home glucose meter. Check your blood sugar 2 hours after your first meal of the day before you start this protocol. Do the same after 1 week. The numbers will tell you the story. Don't make these mistakes. First, don't delay. Starting 10 or 15 minutes after eating instead of 5 dramatically reduces the benefit. Put a visual cue at your table. A small sticky note that says, "Stand up" is all you need. Second, don't rush through the movement. Rapid, bouncy calf raises are less effective than slow, deliberate ones with a brief hold at the top. This is about muscle activation, not cardio intensity. Third, don't skip the after-dinner session. Research consistently shows that the evening post-meal spike is the largest of the day for most adults and causes the most cumulative damage over time. Fourth, don't assume that because you're on medication, this won't help. Clinical trials show that the calf raise protocol lowers post-meal glucose even in patients on metformin and other oral hypoglycemics. It works through a completely different pathway. Fifth, don't give up after 1 or 2 days. The full adaptation of GLUT for transporter density and function in your calf muscles takes approximately 2 to 3 weeks of consistent daily practice. The first few days you may see small reductions. By week 3, the research shows the effect becomes substantially larger. Your body is not broken, your post-meal routine is broken, and that is entirely fixable starting today. I want to hear from you right now. In the comments, tell me which meal tends to give you the worst blood sugar numbers. Is it breakfast, lunch, or dinner? Type your answer below. I read every comment, and your experience helps me understand what you need most. So let's bring this all together. We've covered 7 post-meal strategies ranked from least to most powerful. Simply standing up gives you 11% glucose reduction. Slow indoor walking gives you 22 to 28%. Gentle upper body movement delivers 29%. Seated calf raises deliver 36%. Combined upper and lower body movement delivers 41%. A 10-minute walk 30 to 60 minutes after eating delivers 38 to 44%, or up to 61% when combined with calf raises. And the standing calf raise protocol done within 5 minutes of finishing your meal, done for 2 to 3 minutes at the right cadence, delivers 52 to 54% reduction in post-meal blood sugar spikes. Every single one of these is free. Every single one can be started at your very next meal. And every single one becomes more powerful when combined with the others. My challenge to you is this. Commit to standing calf raises after every meal for the next 30 days. Just 30 days. 3 times a day. 2 to 3 minutes each time. That is less than 10 minutes total added to your day. Track how you feel. Notice your energy after meals. Notice whether that post-meal fatigue and brain fog improves. If you have a glucose meter, watch your numbers. Your body will show you the evidence. You've spent years doing the right things with food. You've cut carbohydrates, counted sugars, watched your portions, and maybe your numbers haven't moved the way you hoped. That's because what happens immediately after you eat matters just as much as what you eat. The post-meal window is where the battle is won or lost, and now you have the knowledge to win it. If this video helped you, please smash that like button. Subscribe to this channel so you never miss a strategy designed specifically for adults over 60. And please share this with someone you love who is managing blood sugar. You might give them the one piece of information that finally moves their numbers. Because aging does not take away your body's ability to regulate blood sugar better. It simply asks you to be smarter about the moments that matter most. Take care of yourself.